Hi, it's Matthew Holt, here with a THCB Spotlight special. I'm interviewing someone I'm thrilled to meet, who is Lindsay Jurist-Rosner. She is the CEO of Wellthy. Wellthy is a company in the caregiving space, and we'll dive into that in a bit. But Lindsay, first, why do you care about caregiving and
Well,
caregivers?
yeah, it's personal, right? I was a caregiver myself for 28 years. I took care of my mom. My mom had primary progressive multiple sclerosis. She passed away 4 years ago. And she was my world. She was my everything. And so, um, I was involved in her care for 28 years, and it was enormously stressful and hard and lonely and expensive, and frustrating for me. And the eye-opening thing for me, as I started to um, meet more people going through their own version of my story, it became clear to me just how many families were similarly struggling to mine. And I became focused. I became obsessed on creating a better experience for caregivers.
No, I mean that's an incredibly personal story, and obviously millions and millions of people are going through this. Somebody watching this may have seen the interview I did with Alex Drain over at Archangels a couple of weeks back, and she's doing the same kind of idea of how do you help identify these people who are there, lonely, alone, have all. I mean, when you talk to Alex, you get all these great data about the stress and the mental health issues that caregivers fall under, and I think it's an obvious thing. So at the time that you were looking after your mother post college and what have you, you also had a job, right? You were working in a sort of regular business. Tell us, what were you doing there, and how did who were you working for, and how did they help, or did they?
Yeah, so I love that question. So I moved home after college, and home at that time was in Washington, D.C., and I was working for a magazine, actually, the Atlantic Monthly, if you know it, phenomenal magazine,
Very
by the
famous, I'm sure. Getting more and more
way.
famous, right?
Yeah.
Go-to source these days for COVID. But anyway.
And such incredible, high quality journalism. So I was really proud to work at the Atlantic. It was my first job out of college, and I had a junior role there on the marketing team, and was trying to build my career and prove my worth, and wanted my team at the Atlantic to feel that I was very committed and focused on my work. But at the same time, I was living this kind of secret double life. I had this other job that I didn't talk about, and that was the role I was playing in the life of my mom. And so, I was helping my mom. I was living at home and getting my mom up in the mornings and helping her with breakfast, and then heading into the office, and then I'd sneak out at lunch and go home and help my mom with lunch and help her in the home, and then help her in the evenings as well. And it was strange. I mean, I didn't have much of a personal life at the time.
Yeah, I
I was
mean, and I'm just thinking, you're young, 20-something in
yeah.
Washington, D.C. It's supposed to be a fun time of your life, and you've got this incredible burden. It's tough.
It's the emotional weight of being a caregiver is not to be underestimated. And Alex Drain does such a good job of talking about this, but it's really like the weight of wanting to be there for someone you love, the guilt, the resentment, it's the stress, the fear, the anxiety, the sleepless nights. Like it's really all consuming for caregivers in a way that I don't think the healthcare system fully appreciates or recognizes. There is no support for caregivers.
Absolutely. So, were you actually hiding this from folks at the Atlantic and you're working with, or
I would.
so they didn't? It wasn't like they weren't. That's what you were trying to say. If I let this take over my job, I will lose my job, and it'll be bad for my career. And so you were trying to basically hide it away.
Yeah, and it's not that I was dishonest. I would mention, oh, I'm going to be out this afternoon. I'm going to join my mom at a doctor's appointment. It's not that I was lying or hiding it, but I did downplay it. I wasn't really talking about, unlike parents who come to work and talk about their kid's soccer game from the day before, or what their kids are going to dress up as for Halloween. When you're a caregiver and you're experiencing, supporting a loved one who's sick or aging or dealing with complex issues, it's not fun to talk about, right? People, when you talk about it, people don't necessarily know how to react, and especially in a work environment, you don't ever want your boss, your employer, to feel like you're not as committed because you're distracted or dealing with this other stuff. And so yeah, I was very, and there's shame, right? There are all these kind of other emotions. So no, I was very low. I didn't want to talk about it in the workforce, and I barely talked about it even with friends and family. Really kind of keeping it to myself and having it as my kind of personal burden that I was kind of dealing with.
So let's switch on to so now you said,
Yeah.
this is a great entrepreneurial entry. I don't know where else you worked after Atlantic. You ended up at Harvard with the MBA and all to it.
Yeah.
Now you said, I'm going to fix this.
Yeah.
What is Wellthy doing to fix this for people who are where you were, a decade or a couple of decades ago?
Yeah. And I'll start by saying, we set out to build Wellthy in 2014, started supporting families in late 2015. And I'll share with you, Matthew, like we knew with total certainty what the problem statement was. And that we wanted to solve the problem for caregivers. We wanted to support families to have better experiences as they were taking care of loved ones. I don't think we knew really what the perfect solution was for families. And so we really did set out to learn and listen and test and evolve. And what we kind of arrived to is that what families are really missing from the healthcare system is essentially the notion of project management, like what we know in business as project management. When you're taking care of a loved one who's dealing with multiple conditions, there's dozens of doctors, specialists, appointments, bills, prescriptions, various equipment, supplies, decisions, a lot, some that's covered by insurance, some that's not. And so, it really is kind of a lot of pieces and parts that need some sort of organization and structure, and need a sense of project management, need a expert to help guide families, but also help the families take some of the burden off and get stuff done. And so we set out on this journey to prove this hypothesis that providing families with sort of a project management software platform could relieve the burden and change lives. And it does. I mean, it's massive. I mean, even for families just to feel like they have a partner and can turn to the partner and say, where do we start with this, and what are our options for this? Can we research this? Can you help us understand what we might want to look at? It truly is life changing.
So tell me a bit about first thing, the product, right? The service. Is it just software? Do you have coaching and or concierge and advocacy help as well? What do I get if I'm a person who's a caregiver and I've signed up for Wellthy? What's my experience now?
Yeah, so the platform experience that we've built is meant to feel, really modern and allow you to come and really experience three things as a caregiver. One, allow you to feel like you have your head around a plan, to learn kind of the various considerations of complex care, the legal, the financial, the in-home, the housing, medical, and social emotional. Those are the 6 aspects. And then secondly, to get stuff done. And that's where we have a team of incredibly talented humans, care professionals, mostly folks with social work backgrounds, but additional folks with all sorts of areas of expertise. And then the third piece is to connect. And so we're launching community in Q4. And this is a very powerful new part of our solution, which allows families to connect with other individuals who are like them and going through a similar journey so that they can share notes then and just feel a little less alone. So that's really what the family gets out of the platform experience. So yeah, it is kind of software and a sense of feeling organized and centralized and kind of a digitized experience for complex care. And then that human partner, that care coordinator who really gets to know the family's goals and needs and situation and gets things done.
And give me a sense about, when I'm using it, how often am I touching your care coordinator, social work type person? And the community obviously will be helpful later, but that's coming. And I'm sure there are also other communities already for caregivers on Facebook and God knows where else. But in terms of how much am I touching that and how much am I using the tool to sort of manage, to get stuff done?
Every family is so different, every situation is so different. So it depends on the moment in time. Families come to us really in one of 2 states. It feels like, the one state is after an event. So in a reactive state, there's been a fall, a new diagnosis, some sort of event, and families are trying to kind of navigate through a transition of care or some sort of set of decisions. And so there's a checklist, kind of a to-do list of like, do we do this? Do we do this? What are our options for this? We're kind of working through that that checklist with the family. The other need state is families who come to us and they've been taking care of a loved one for a long period of time, and they're just drained, they're tired, they have a really full plate and they need some help. And those are oftentimes parents who have children with a special need of some sort, or people like me. I was a adult daughter who was taking care of a woman with MS, but sub in Parkinson's, ALS, dementia, and it's the same problem statement. And so, for situations where, it's spiky, right? Like, it's like, I tell people it's like, game of whack-a-mole, like, as things pop up, families come to us needing help, and then sometimes things quiet down. And so we do see that of the people we support, it's 25% of people who will return to Wellthy for additional support within a 12-month period. So kind of, spikes up and down as needs arise. But people will engage with our platform, access resources and information on an ongoing basis. To your point about community, by the way, there are great Facebook groups. We're not looking to replace that. What's missing on Facebook is the expert moderated groups. Yeah.
I think we could say moderation on Facebook is missing in a big way, but that's a separate topic.
Separate topic, but totally.
As of today, it's called Meta, by the way. They just changed.
That's right. That's right. Meta. Yeah.
I've always seen jokes about it's metastasizing.
That's right.
All right. Let's talk about distribution and the business, right? So you've decided, maybe I don't know if it's exclusive. Your primary target is to say, let's go to employers and find presumably support for people like you were when you had a day job and we're trying to sort of do this. So talk about a bit about what the pitch is to employers and how the sales process and the rolling it out is going with employers.
Yeah, well, we love working with employers. It's such a win-win, right? Companies are great resignation, right? We've seen 3 million women step out of the workforce in the last year. And we talk about women stepping out of the workforce because of childcare, but I want to make an important distinction. Women are not stepping out of the workforce just because of childcare. It's because of childcare plus, right? Taking care of kids and aging parents and other care needs and demanding job and this concern and that concern. It's just a lot, right? So we see this, it's the sandwich generation. And so it's a pervasive problem, mid to senior level women who are, taking steps back in their career or stepping out of the workforce or, turning down career advancement opportunities because of their care situation at home, because it's just too much. And it still falls on women. So we feel strongly that this is a women's issue. It's a diversity issue, and companies are seeing it. They feel it, especially through the pandemic. So it's a win-win. For employers, we're helping, caregiving employees to be able to, remain in their job and be focused and feel like their care needs are being taken care of. And then for these employees for caregiving, it's life-changing, right? To be able to, make sure your loved one has the care that they need, but also stay in the job you love, be able to earn income and contribute and support your family. It's very important. So we feel strongly that this is a critical societal issue. It's a future of work issue. And so we love to sell into employers. We have, incredible companies that provide Wellthy to their employees, across all industries, Accenture, Facebook, Best Buy, like professional services, financial services, tech, but also retail, manufacturing, oil and gas, defense contractors. So we see, caregiving is pervasive across all industries. The sale is, listen, if we can retain just three of your senior women for a mid to large company, we pay for ourselves in the cost of, recruitment and training and lost institutional knowledge. It's a simple formula, and companies get it, especially right now.
So how do you, number one, how do you charge them? What's the sort of, how do you get paid? Is it on a sort of per use basis, on a PMPM, or what do you think of? And related to that, how do you distribute? How do you get in front of, because there's a lot of pressure getting in front of the HR people, etc. at the moment. So this is one of issues, but they have, musculoskeletal care and diabetes and this and that and the other and PBM. So how do you charge and how do you get into more of the employers? Have you made that success?
Yeah, so well, we have a flexible pricing model. So we offer, we can do a PPM if a company prefers that. We can do per utilization if a company prefers that. You know, we have really good data on expected utilization. So we can work with the company to say, here's what you'll, based on your workforce, your size, your demographics, here's what you'll see in terms of utilization. They can help, that gives them a sense of budget and what they might expect to see. But in terms of how we get into employers, you know, one of the benefits we've had over the last couple of years is just, you know, bit by bit, employer by employer, proving value, building champions. You know, our client base and our client advisory board includes, you know, the biggest name client, you know, companies out there. And so, so frankly, that helps, right? You know, they introduce us to their colleagues and you know, once you get some tech companies, that helps you go to more tech companies. And now we have great partners and folks like Willis Towers Watson and Mercer. They see the value with their clients and they've started to bring us into their clients. And then we have some channel partners. We have a really great partnership with Prudential. Prudential feels very strongly that caregiving is not only kind of, it doesn't only impact individuals' healthcare and you know, career, but it also impacts their financial wellness. And so we're part of their financial wellness story. So we'll continue to launch some more channel partners.
So is it fair to say early on it was sort of, you know, block by block, hedgerow by hedgerow, and then later on it became Towers Watson that started noticing that you were actually already doing it?
Starts getting going. That's
so
right. That's
so
right.
You were hustling first, and now you're a bit closer to being part of the mainstream, as it were. Excellent. So let's just talk a tiny bit about the company. Just to,
sure.
You guys raised 50 million this past summer, right?
We've raised 50 million in total. We just closed at $35 million.
Sorry, 30 million. Yes, that's right.
In
almost barely worth mentioning these days in digital health. You know, hardly around the error.
Pennies.
So give me a sense of the pace of growth. Just give me the size of how many people you have, size of the company. Give me a sense of your number of clients you brought on and number of users on the system. Just give me a sense of how that's, you know, gone over the last 3 or 4 years as you've been running it out.
Yeah, we've had a tremendous couple of years, and we don't see that slowing over the next couple of years. So we tripled last year, we tripled the year before, we'll double this year, we'll double next year, and our team is now at just under 300 people. Can
you give me a number of either employers who bought in or people who are using the system?
So our number of clients is around 80, which doesn't sound like that many, but we have some really big clients. So the total number of covered lives is 1 million. We're going to reach the 1 million mark in the next couple of months. We're currently at 920,000 covered lives. So that's if you add up all of the employees who have access to Wellthy, all of the employer clients we serve. And
then just, I mean, this is probably interesting. I mean, in terms of distributing within those companies and telling people about it, how does that work, and how many people are signing up? Because obviously there aren't 1 million people who've got what is a problem, but for people whom it is a problem, it's a huge problem, right? And then
it's a huge problem. And by the way, it's a bigger problem than people think. So at any given moment, it's roughly 20% of the workforce that's in an active caregiving situation at that moment. So you think about, okay, it's 20% of the workforce, but not all 20% are going to be willing to reach out for help, kind of aware that they're even a caregiver, knowledgeable that we exist. So we do see a portion of that engages. Our utilization across a year can range. The kind of most common range is right around kind of 3 to 5%. But I'll caveat, many digital health companies talk about utilization and engagement in a much broader sense than we do. If we count signups and people who reach out and come to our events, it's much bigger. It's closer to 10, 15% of any given workforce. But of the people who work actively with our care coordinators, it's about 3 to 5% of the workforce per year. I tell people it's outsized impact for the number of people who engage, because of the people we're supporting, it's, you know, it's literally retaining that individual, because otherwise they would take a leave of absence or quit because it's too much that's on their plate. So it's outsized impact. But yeah, I mean, you know, we see an opportunity to do more. We're constantly working to raise awareness, because, you know, as we started the conversation, people don't self-identify. So we have to talk about Wellthy support in specific use cases. You know, if you're taking care of an aging parent, if you have a child with special needs, if you're a veteran and navigate, you know, so what are the need states where we can provide value? So that's a lot of the work that we do currently.
Fantastic. Well, the one last sort of joke comment I make is that the name. There are like 15 different companies called Wellthy, Wellthy, right? Spelling differences, you didn't think of going something that was a bit more obvious?
I mean, what the heck? I mean, but the funny thing is we still get, people love our name. They think it's very clever. Some people think we sound like a financial, like a fintech company. So we get a lot of commentary on it. If you can come up with a better name for us, Matthew, we'll take it. But right now, the wellthy.com, we haven't come up with anything better. So,
well, don't worry. I'm sure somewhere in that 37 million, there's a big fee for me for renaming, but maybe the
done.
Done.
Absolutely.
It's very tricky, right? I mean,
Right.
part of what, I tell this to all the companies I advise, part of what you've got to worry is how do you stand out and how do you identify yourself? And I think, that doing this kind of interview and getting your name, and obviously fundraising doesn't hurt, but the most important thing is, can you get the people who need you, those employees who have that name, to understand what you are there doing and the help you can give them? And that's if that seems to be working well, so keep doing what you're doing. And you said you've got 1 million lives under management. There's 110 million people in the workforce, so you've got a way to go.
We get some room. We get some room. So we'll get there.
All right. I've been speaking with Lindsay Jurist-Rosner. She is the CEO of Wellthy, which is a really exciting entry into the caregiving space for employers. Lindsay, thanks for your time.
Thanks, Matthew. Thank you so much.